Mindset mentor with the beautiful Amanda Randall, who is a open heart coach. And when I hear about the heart concept, it just, a matter of the heart. Our heart speaks volumes. Out of our mouth is what comes from our heart. And we always think of the emotional part of it, but never the physical part of it. And in my family, we've had tons of people, like I think 95% of my family have passed away from some type of a heart disease and heart issues or what have you. And I know a few years back, I had heart pain, chest pains. And because of the history of my family, they kept sending me for all these heart tests. And I'm like, well, what are you testing for? Like, my pains are up here. Isn't my heart down here? Totally lost and confused and concerned because I was under 40 years old and I really didn't, I was at the mercy of this medical staff, not knowing what to do. And after much digging, they found a microvalve prolapse, which I was told was no big deal. I still don't really know what that means other than maybe my heart skips a beat. So it's really incredible that Amanda, who has experienced open heart surgery, has a passion to share on how to navigate this system. So Amanda, I'm so excited to hear your full story from the beginning to the end. Thanks for taking the time to be here and share with Social Salad Society all the great things about your incredible program, Open Ears, Open Heart. So tell us about this journey, like your experience with Open Heart and what makes you so passionate about helping people in this area.
Sure. So my journey with open heart surgery and heart care basically started when I was born. I was diagnosed with a birth defect called tetralogy of Fallot at about 2 weeks old. And I had my first open heart surgery when I was 10 months old to repair most of the defects caused by that condition. So that's how it started. Throughout my life, I'd had multiple other like less invasive procedures, catheter procedures and things like that. And I had always kind of religiously had to go to my cardiologist. And as I got older, I wanted to know more about the heart and about these defects. And I even did, I think I was in like 3rd grade, I did like an independent study project about heart defects, because I wanted to know what was going on with me. And I wanted to know what they were talking about, kind of, sort of, when I was having these conversations with my parents were, at that point, I was like 8, having these conversations with my cardiologist. So that continued basically from, 10 months all the way through my childhood and adulthood. I would have these procedures done, these like less invasive catheter procedures every couple of years, because part of my defect was that the arteries that go from my heart to my lungs were too small. And so what they did was they put in these, they're called stents, but they look like stainless steel, like Chinese finger traps. So they're like these like mesh things, like tubes. So they did a catheter procedure and they put these little tubes into those arteries to kind of hold them open. But then the problem was that those don't grow with you. So I had that when I was like 8. And then like every other year after that, I had to have another catheter procedure to widen those as I grew until I was like 16 or 17. So that was kind of my childhood, adolescence, was these periodic catheter procedures. And then when I was about 21, my cardiologist started talking to me about my pulmonary valve, which is one of the valves in your heart that when your heart pumps, it opens and lets blood through, and then it's supposed to close back again so it doesn't come back. But mine was, because of the birth defect, was not doing that. And as I got older and as I got bigger, it became more and more of an issue. So when I was about 21, my cardiologist started talking about a valve replacement. And so we monitored it for a couple of years with tests and things like that. And then when I was 25, I went in for my annual cardiology appointment. And they did a stress test where they hook you up to a bunch of machines and you walk on a treadmill until you get tired. And those test results showed that my heart had diminished functioning based then, like from before. It was functioning better before than it had been when I was 25. So they said, okay, it's time. And so I started preparing for a second open heart surgery, which I had in May of 2018. I had the pulmonary valve replacement, and that all went well. It all went smoothly and everything. It was fine. But through that experience, kind of realized that there was a gap between what my medical team, my doctors and nurses were telling me was going to happen and how this process was going to go, versus what I actually experienced when I was going through it. And a big part that I felt like was missing was the emotional piece of that recovery. They talk a lot about wound care and physical therapy and all of those like physical things that help you heal, which are absolutely important. But I felt like really kind of blindsided by the emotional stress and trauma and turmoil that I kind of fell into after my surgery that I really wasn't expecting, especially because I'd been around all this stuff like my whole life, basically. So that is how I started coaching heart patients, because I felt like I had something to offer of like, this is how it goes, like for real.
Yeah.
And so that's how I started the coaching program.
Wow. And I can't even imagine like going through all that, the toll on your physical body to have the surgeries, to go for the testing, and kind of just been told okay, so medically speaking, scientifically saying this is what's going on, but then how that impacts you and how you receive that information. So that affects your emotional part, that affects your heart. And then all of a sudden, you got that heart head thing going on, and then your body's got this physical stuff going on. So it affects your whole being. And we don't, like anytime somebody's dealing with any kind of a health issue, we don't realize the effect that it takes, the toll that it takes on our body, our emotions, our mental state. And then, other things happen, like a domino effect takes place. Did you find that the case for you as well?
Yeah, absolutely. I felt like I honestly felt like I remember telling my husband, I felt like I left a piece of my soul in the hospital. Like I felt like they fixed my heart and they like replaced this valve, but they must have taken something else out, because I just did not feel like the same person. I felt much more detached spiritually than I had before the surgery. I had always struggled with anxiety pretty much my whole life, and they connected that back to like my original surgery. But it got bad after the second one. And things were making me anxious that hadn't made me anxious before. I was really emotionally reactive to things. I would like cry over nothing. There was one time I have like an essential oil diffuser, and it had like a frosted glass like tube over it. And the first time I took it out of the box, I dropped the glass tube and it shattered. And so it started like that, and it ended up with me crying on the bed saying, I'm broken, I'm broken. And then I realized, like, this is not about the glass.
Yeah.
So yeah, I mean, it definitely took a toll on more than just my body, which I kind of wasn't expecting.
Mm-hmm. Yeah, and just having that physical event happen where you drop this expensive piece of glass on this beautiful diffuser and seeing all those pieces shattered, I imagine your subconscious looked at that and connected it. You know, you have this heart that's been shattered, that's been not functioning since you were born, and you've had to deal with it your whole entire life, but it seems like you never dealt with the emotions, you never grieved that part of that physical part of your body not working. Because if you were growing up, like all kids do and adults do, we compare ourselves to others.
Mm-hmm.
You know, and I imagine, and you can share with us your point of view of this. I imagine you were like, well, they don't have to go to the doctors, they don't have to see it. How come they have a healthy heart and my heart's not healthy? Did you have any of those thoughts or things going
It
on?
was, for me, I think the hardest thing was gym class. Because the cardiology appointments weren't so bad, because like my mom would like take me out of school early, and then like I'd get like a stuffed animal or something, like, so like I was like cool with. But what really was hard for me was, especially like as I got older, like in middle school and high school, when we would do like presidential fitness testing and things like that, where you had to like run a mile. And that was like a nightmare, like an absolute waking nightmare for me, because I just couldn't ever, because my heart wasn't functioning at 100% ever. I couldn't run like other kids did. I couldn't run as long as they could. I couldn't push myself as much as they could. So I ended up being the kid that was always last coming in, running the mile and stuff like that. And so that's when it really kind of affected like my self-esteem, and like started comparing myself and saying like, why can't I do that? Why can't my heart be normal? Why can't I like at least keep up with everybody else?
Yeah. Yeah, and having those thoughts at that age, especially, you know, because we're, you know, in general, when we have our heart, when we think about our thoughts and they go into our heart, we start comparing ourselves and we start thinking, oh, well, I should be like this person, and why can't I do that? And then that goes into your psyche, and before you know it, your actions are defining you. Like, I can't, so I won't, and I don't. And as an entrepreneur, I'm sure this affects you from moving forward, from launching, from scaling, from, you know, I'm sure there's a lot more work to do, as all of us have, just to focus on those thoughts and captivate them and really understand, like, no, I can overcome this. And I like how you found the good in the doctor's appointments. I got out of school early. I got a stuffed animal, you know, you got to spend time with your mom, you know, one-on-one. So looking for the good in all that had happened and realizing that, yeah, I did have this growing up, but I'm going to turn around and I'm going to help people navigate it. And I find the medical field very confusing. They so many hard workers. I mean, kudos to the nurses and the medical staff and all of that. But I imagine, like, you know, they come from an angle of, okay, medically speaking, scientifically speaking, Western medicine, this is what we need to do. A lot of times they put a Band-Aid on it. They don't get to the root cause. And it's been sad, but unfortunately, people with anxiety do get chest pains.
Mm-hmm.
I had anxiety, depression for years, and those chest pains were a result of that. And they want to throw medicine at it. And I'm not a medicine person. And I'm like, no, there's got to be something else I can do. What else can I do to relieve this? And being so paranoid, because people in my family all had heart attacks, congestive heart failure, what have you. And realizing I don't want that. I don't want to have an unhealthy heart. So what can you do? So is that how the EARS program, Open Ears, Open Heart, started for you?
Yeah, so it started really as something to kind of fill the gaps that I saw as a patient going through open heart surgery. the gaps in information, the gaps in, I guess, because they give you information, right? They tell you what they're going to do. My surgeon was actually, I know that a lot of people don't have this experience, but my surgeon was actually really nice.
Mm-hmm.
He came in and it was like a 5-minute conversation, but he explained what they were going to do and stuff like that. But if I hadn't been like studying the human heart since I was like 8 years old, I would have no idea what he was talking about. And then, I went through it and they're telling me like, oh yeah, you can go back to full activity after 6 weeks. And it's like,
Wow.
okay, but what does that really mean? It doesn't mean you're going to be back to normal and you're going to be able to do everything that you could do before after 6 weeks. And they don't explain that ahead of time. And so you get to your 6-week mark and you're like, why does it still hurt to turn the steering wheel of my car? Not knowing that that's normal. So I started the program so that people who are kind of at the beginning of this journey of prepping for open heart surgery and recovering from open heart surgery, that they can have this information and not just the like black and white, like here's the pamphlet that the medical staff gives you, but like real experience of what it's really like to go through this.
Mm-hmm. Yeah, and that's really important because actually on my podcast yesterday, I interviewed a woman who had a mastectomy, and she was saying she had like T-Rex arms for weeks afterwards, because when they cut you open, they don't just work on that one area. It affects all the nerves and the muscles. And, I never realized that until I had my own surgery, and I thought, oh, wow, yeah, you don't realize, like you said, steering a car wheel, being limited, like all of a sudden, like you can't vacuum, you can't push this, you can't lift that, you can't go to the grocery store by yourself. There's all these can'ts, or shouldn'ts, and you got to take it easy, and and that really plays plays on your psyche as well, because before you were doing all these things, and all of a sudden you're like limited, and your mind wants you to go forward. So yeah, it's so important. And not to mention the side effects of the anesthesia and the pain meds that they give you, that stays in your body and causes havoc on your hormones, your emotions go array, and that you feel like you're all alone. And you're like, why am I having this anxiety? And, a pill's not going to help it. You don't need a Band-Aid. You need to get to the root cause. And that's what you do for people. You get to the root cause, you help them navigate it, go through all the details of like, this is, what to expect, this is what's going to happen, this is how you're going to react, this is how you're going to respond. And here's some remedies that you can use to help. So tell us a little bit more about that, some of the tools that you use.
Sure. So the program is broken up into years. So education, advocacy, recovery, and self-care. And those are basically the main tools that I use to help people kind of get through this whole experience with confidence and feeling like they kind of sort of know what's going on. So the education piece is basically what I had been doing with my independent study projects and my school projects and stuff since I was a kid, learning about how the heart works, what exactly your disease or defect does and how that affects how your heart functions, and kind of what your treatment options are for that specific condition. And I find that helps people to not feel lost when the doctors are like talking at you, because they talk at you sometimes.
Mm-hmm.
And so that you kind of know what's going on, and these words that are getting thrown around and these acronyms that are getting thrown around aren't completely foreign to you. And so that you can have productive conversations with your medical team. And and you're not asking them like, okay, what is that? What is that? What is that? And you can move on to, okay, how do we actually like fix this? And then the second part is advocacy. Learning how to advocate for yourself with your medical team, making sure that your needs are met, because I think a lot of people, especially right now, have a kind of adversarial relationship with medical professionals where we kind of are like working against each other. And so what I teach is how to kind of be on the same team with your doctor and work together and talk about, okay, how are we going to fix this in a way that is going to make my life something that I still want to be living? Then the third part is recovery. And that's when we really talk about, so the one side of it is kind of the tips and tricks that I learned going through open heart surgery, how to recover and what to do and what not to do and all of that kind of thing. But that's when we really kind of dig deep into the emotional piece, and start talking about different skills, and different resources, to recover emotionally from that surgery. And then the last part is self-care. And that is sort of looking more long-term past your, kind of acute recovery from the surgery, and how you want to take care of yourself in every facet of your life so that you're able to live your life the way that you want to. I know a lot of people who have been diagnosed with a heart disease or defect, and they're told they need open heart surgery, and they just think that their life is over. Mm-hmm. And it's not, it's so not. And so we talk about how to take care of your emotions, your body, your spirit, your everything, to make sure that you're living life in the fullest and most fulfilling way that you can. And also that you're taking care of yourself enough that like, hopefully you don't need to go through this whole process again.
Yeah, because it's so important, because that post-care doesn't happen. I know I was recently in the hospital and I had no clue. I got discharged and they gave me a sheet like, this is what you have. They gave me a diet, which I'm not accustomed to. And I'm like, I don't eat like this. What am I supposed to do? And I had no clue. I was totally clueless. I had to reach out to a functional nurse to be able to help me navigate how to heal my body. And slowly, and I had no clue that the anesthesia stays in your body for up to a year. So anytime you have procedures, I also didn't know that once you're on antibiotics, you need to take a probiotic to help counterbalance that. Simple things like that that they don't tell you. Mm-hmm. That help you recover and get your body back quicker, like detox fast, with Epsom salt. And of course, we're going to throw baking soda and young living essential oils in there as well. But what I love about your program is that you navigate it. And because you're a licensed social worker, you actually have that piece where you understand the mind and the thoughts and the emotions. You have that personal experience. So that's an incredible way to just connect, for people to connect with you and really understand. And I have to share a personal story, not mine specifically, but my daughter's friend passed away from a heart attack, 30 years old, a few weeks ago. And it was really, really sad because he was getting care for chest pains that were related to anxiety. And they kept treating the anxiety, not looking at the heart. And whatever happened, he ended up having a heart attack at 30 years old. And I was shocked. It was like, what? Like, how does that happen? And, I think it's because people, I know when I was not feeling well, I didn't know how to explain what was going on. I just knew I had pain. I didn't know what was causing it. And I was able to centralize my pain, which helped the doctors navigate. But sometimes you don't know, especially when it's with your heart area, because, I know I go for monthly massage, and when I have pain in my shoulder, it could be something that's way down in my lower back that's causing the pain in my shoulder, because of the way everything's connected. Mm-hmm. And like when you do have that surgery, when you do have those tests, sometimes, if they don't dig deep enough for whatever reason, because you're not able to express it. So to be able to have the tools to say, this is exactly what I need to ask my doctor. This is exactly. I'm taking a class called church administration for my degree. And last night we were talking about things to know about setting up your entrepreneurial world, setting up an S corporation, C corporation. And one of the things that you want to do is ask people, are you insured? Like if you hire somebody, a roofer for your house or somebody, are you insured? I need to see your insurance papers, or, do you have this certificate, or do you have this, what's your constitution? What's your policy? What's your mission statement? Some things that you wouldn't think to ask for when you're working with somebody, or you're checking out a new place to connect with. So same thing when we go for our medical care, there's certain things I have no idea to ask the doctor. Like I knew something was wrong with my body, but I didn't know, like, what kind of a test can you do to test this? And he's like, well, he's my gynecologist. Well, I'm the gynecologist. I have no idea what you're talking about. This is kind of blood work I do, and this is why I do it. Okay, so how do you test for like not being able to sleep at night? Like what's causing me to be fretful? Like, well, we can check your thyroid, but then your thyroid comes back normal. And then what? What do you do from there? So that's where you come in, right? You come in and say, nope, this is the path that you take. And that's so amazing. So you have a program. Tell us about your program.
Right. So the program is Open Ears for Open Hearts. And the reason I called it that is because of the acronym EARS, but also because I felt like it was it really encompassed what I wanted the program to be, where you have someone who's been there, who's been through it, that's able to talk to you about it and listen to you about what you're experiencing, as opposed to just going to the doctor and being like talked at for 15 minutes or whatever, if you're lucky, 15 minutes, and then being sent home. So it involves online modules. It also involves group coaching, and then you can also schedule one-on-one coaching with me, because I feel like everybody's journey is very different when it comes to open heart surgery, depending on why you're there and how old you are and stuff like that. So I felt like it was really important to have that one-on-one to really say, okay, how do we apply this to what you personally are going through?
Awesome. And it's 8-week program?
16
weeks. Okay, awesome. Mm-hmm. Well, thank you so much for sharing that. We're going to put a link in the description. So anyone out there who is dealing with heart issues, open heart, somebody, please share this with them. Grab the link to connect with Amanda, hop on a call with her and see if she can help you. Because I know a lot of you have heart issues, and even if it's an emotional heart issue, Amanda can help you with that as well. So thanks, Amanda.
Thank you, Lisa.